Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Legg-Calvé-Perthes disease, also called LCPD. Legg-Calvé-Perthes disease is a childhood condition that affects the hip joint, where the blood supply to the femoral head is temporarily disrupted. Femoral head and the acetabulum of the hip bone forms the hip joint, and hip joint is a ball and socket type of synovial joint, and femoral head is the ball and the acetabulum is the socket. So what happened? Blood supply to the femoral head is temporarily disrupted. This lack of blood flow causes the bone to die. There is avascular necrosis, cellular death due to lack of blood supply, and can lead to collapse of the femoral head. Over time, blood supply returns and the bone begins to heal, but the process can result in a deformed femoral head if not managed properly. What are the causes and risk factors? The exact cause of Legg-Calvé-Perthes disease is unknown, but several factors may contribute, including genetics, a family history of the disease, age and sex, more common in boys between the ages of 4 and 8, socioeconomic status, higher incidence in lower socioeconomic groups, activity level, active children may be at higher risk. Symptoms: limping, pain or stiffness in the hip, groin, thigh or knee, limited range of motion in the hip joint, muscle wasting in the thigh. Muscle wasting happens because if there is the movement or movement is restricted, then muscle will be atrophied gradually. Diagnosis: physical examination, assessing pain, range of motion and gait, imaging studies like X-ray, MRI, that is magnetic resonance imaging, or bone scan to evaluate the condition of the femoral head. Okay, so if we look at this, here is the right side. Femoral head is decreased in size and it is deformed on this side, and this is the pelvis of a child, and this is the Legg-Calvé-Perthes disease. It is unilateral usually, but it may be bilateral too. So what we are seeing, there will be avascular necrosis of the head area. This part will disappear because of the avascular necrosis, the damaged flattened femoral head. Okay, and this is the growth plate here. Child is around 4 to 10 years. There will be limping. Okay, there will be muscle atrophy eventually. Treatment of Legg-Calvé-Perthes disease. The goal of treatment is to ensure that the femoral head remains as round as possible during healing process. Treatment options vary depending on the age of the child and the severity of the condition. Rest and activity modification, reducing weight-bearing activities, physical therapy, exercise to maintain hip mobility and muscle strength. Brace or casting to keep femoral head in hip socket. You can say acetabular socket. There is a part of the hip joint. Medication for pain relief, it may be any painkiller, maybe the NSAID, maybe even aspirin. In children, we always discourage to give aspirin, but ibuprofen may be allowed, NSAID, or maybe even paracetamol or Tylenol. Surgery in severe cases, procedures such as osteotomy, realigning the bone, or joint reconstruction may be necessary. Prognosis. The prognosis for children with LCPD varies. Younger children tends to have better outcomes because their bones heal more efficiently. The long-term outlook depends on the severity of the disease and the effectiveness of the treatment in maintaining the shape of the femoral head. Some children may develop arthritis or other hip problem later in life. And that's all about Legg-Calvé-Perthes disease, simply called Perthes disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.